a very complex topic, like we're saying, COVID-19 health versus market emergency in the financial markets that we look at today. Everyone's mind is on money. Everyone's mind is on how can we revive the economy back while being healthy and safe. So we are trying to touch upon as much as we can in these next 30 minutes. So thank you so much, Ankit, and thank you so much, Sanjeev, for talking to us today.
Pleasure to be here. And what an appropriate title for this thing, Clean the Air. Even though the topic is not environmental in nature, but I think Clean the Air is an appropriate title for what we're discussing today.
Thank you so much, Sanjeev. It's been a complex 1.5 years for all of us, and the second wave, as we all know, has hit India hard. So, Ankit, I want to start with you by asking you, how has, from your perspective, sitting in the startup world, running a fintech company, impacted the financial systems and the economy at large?
Um, so I think it really depends on where you are placed in the financial services sector or where you are placed in the socio-economic ladder, I must say. Because I think what's happened is as we went into the pandemic, everyone was unsure on how the recovery will pan out. And while we're still not sure on how it's panning out, more or less the indicators are it seems to be more like a K-shaped recovery. Because if you look at all possible traditional indicators, whether it be around the stock market, asset prices across the board are going through the roof. So I think all that really tells you is everything is hunky-dory. I think I just saw news on NDTV which says that the collections to date of GST this year are 100% of the collections till date as of last year. So I think that metric again tells that things are looking bright and rosy. But I think it kind of hides the fact that there is a certain sector of the economy that has been left out, or it's still reeling under the effects of the pandemic. And that's where I call about the K-shaped recovery, wherein you have a certain segment which is going up and you have had huge wealth creation when you talk about the billionaires. But on the other extreme, you have people who really lost opportunities and they have lost even the possibility of getting back into the working culture, because you've had tech disrupting things which might be taking away jobs in certain areas. So I think that's really how the economic sector has played out. Now, in terms of the financial services, and I talked specifically about lending in general, the way it's panned out is something we have seen again, that early on there was a moratorium period, and so there wasn't really clarity on who is repaying and who is not. And then off late, what we've observed is there are segments where there is significant stress, in the sense that, I mean, at the end of the day, people have lost their livelihoods and they're not getting jobs. I mean, I know of borrowers who have an intention of repaying, but they don't have a job. How will they repay? So that's definitely been the challenge. But on the other side, you see consumer durable financing. So we have an entire segment wherein you have relatively well-off people who are trying to, let's say, buy a mobile and pay it off in 6 installments, or buy a high-ticket education course and pay it off in 6 to 18 installments. They are very well off and they're getting a benefit because of the low interest rates at this point in time. So overall, I think from a policy making standpoint, people have done the right things. Of the government and the central banks have all across the world have done a case of printing money, pumping money, which has inflated asset prices across the board. But I think that reaching the last mile still needs to be done, to be very honest. So that would be my, I would say, opinion or my perspective on the entire landscape.
I mean, we're all talking perspectives and only today, and it like I said, it's a very complex and large subject to touch on, and maybe one webinar is not enough for it. But in any case, yeah, there has been a very diversified kind of impact on the economy and on financial systems. But Sanjeev, we are also having different parts of the country that's slowly opening up again. So this is, for the nth number of time, they're opening up again. Businesses are slowly resuming. So while there is a positive ray of hope that economies might revive and businesses might revive, there is also the fear of health and safety, which is much stronger this time around than it was last time. How can we balance the two? How can the two be balanced? Because it seems very impossible at the moment.
So, I'll just add a couple of my thoughts with respects to what Ankit said. I am by no means an economic guy or an economic guru. Most of these terms kind of go bouncer over my head. But I think from my vantage point, looking at it economically in a very, very different way, Ankit's taken a very macroscopic look at the entire component. But I'm looking at the people that have touched my life and that have been impacted economically. From my travel agent that says that I'm not able to, sustain a livelihood, to my maid who went into debt at the first lockdown and is still struggling to come out of that, to the dabbawalas who serve in Bombay that are not able to provide meals. So the roadside vendors. So I think that, while much is being talked about what happens to the economy at a macroscopic level, and of course that trickles downwards, I think that the quantification of the hardship that is there at the ground level of many people, I don't think is being spoken about sufficiently, and I don't think is being addressed adequately across the board. I don't have visibility. Like I said, I'm not an economic person, but I do see the amount of hardship that people are encountering. To me, it seems that this pandemic has kind of increased the divide between the have and the have-nots. And if you look at it macroscopically, if you zoom out, the richer countries' access to vaccines and the poorer countries' access to vaccine is another example of the entire thing, right? So it's morally, it's a little annoying, so to say, that once again we are at the crossroad where the entire world is in a pandemic, and we're saying all come together, but somehow the haves still seem to have better access than the have-nots, right? That troubles me from a moral perspective, being a citizen of the world. In terms of balancing healthcare, yes, so there are a lot of concerns, and legitimately so. I think that when the first lockdown opened, I noticed with so many people that I know that there was a very casual attitude towards the entire opening up of offices, right? And a lot of people in senior management roles felt that, people are not working from home. They need to come back to the office. There was enforcement of those kind of things. And then when the second wave hit, now everybody's gone into hyper awareness, right? My principle from a healthcare perspective, prevention is easier than cure, is cheaper than cure. And I think a tremendous amount of effort needs to be put into prevention. And prevention of COVID really is not rocket science, right? It's very, very, very simple. You hear the same messages playing on your ringtone. You hear the same messages in thousands of posters and all of these things. And it's basically maintain distance from people, wear your mask, sanitize your hands. If you do these three things well, the chances of you getting COVID are significantly lessened, number one. Number two, we have the vaccine now, which was not there at the start of this year. When the first lockdown opened, we didn't have access to the vaccine, right? And while there are a lot of, so to say, questions or concerns about, how can a vaccine be released so quickly, what other option do we have right now in terms of restoring the world back to normal? So I think a tremendous amount of focus has to go out from employers, encouraging them to get, not forcing, at the end of the day, it is an individual's prerogative to get vaccinated or not get vaccinated. But I think employers must focus on ensuring that the entire workforce of an organization is on the same page, has the same level of awareness, and what happens is that everybody's on the same page. If the leadership of the organization is kind of mandating that, then that kind of works, right? It trickles downwards and everybody's on the same page, and thereby you prevent the number of infections that are kind of happening, right? Let's not also forget that it's the same person that's in the workforce that's going home, is in a community, is whatever. So a more educated, more aware, more conscious citizen at the workplace automatically becomes a more conscious citizen, generally speaking, at large, and spreads the word. So I think, and we're doing work at StepOne, we're doing work with some organizations that's encouraging not just their employees to participate in coming across, coming to a platform by means of which everybody's on the same page and having the same level of awareness, but also encouraging the family members. So there are webinars that are being done in the evenings by means of which family members can participate, ask questions, alleviate myths and misconceptions. And I think that this is something that the workforce must consider doing at a very, very scaled level before bringing people back to work.
Um, Ankit, from a startup founder's perspective, I just wanted to understand how can everyone work together, whether it is within an organizations or startups together, because we do see a lot of rallying force of startups, investors, the whole community and ecosystem working together. But what more can be done in this front, because businesses, like we said, are suffering as well. So how does this turn out?
So I think you actually touched upon that startups are actually coming together to do things together. So I'll give you examples that we have seen at our company itself. I mean, we've worked with other companies where, let's say, we don't have a critical mass in Mumbai of number of employees, but we work with other companies to ensure that we are participating in their vaccination drives, so that our employees can go there and get vaccinated. Right. So I think things like that are helping everyone. So Sanjeev's point, kind of getting people vaccinated is prevention is one of the first steps to solving the problem. I think that's in my mind the number one part. So if you don't have a critical mass, work with other people in your ecosystem, work with other folks to figure out how you can get your employees vaccinated. And I think Sanjeev talked about moral issues. I'll say, even if I talk purely from a capitalistic point, I think even if I don't talk about from a morality standpoint, I think an employee who is not who's concerned about his or her safety or concerned about the safety of their family will not be productive. And similarly, if they are sick, they cannot be productive. So I think it is actually in the self-interest of all the capitalists to do everything for their employees. I think it's not even a morality question; it's a self-interest question in my mind, to be honest. I think.
Conscious capitalism, Ankit. That's
Pardon?
called conscious. That's called conscious capitalism.
I think we can call it any way, which way. I believe in capitalism, so I don't want to put adjectives in front of it. I think true capitalism that is capitalism. Now, whether we want to put it conscious, responsible, that might be something else. But in my mind, that's basic capitalism. So that's the first thing. I think the second thing is really adapting, because I think understanding what the again goes back to uh, what will be the future of work, or what's the current framework. So I'll give you an example. Frankly speaking, at GyanDhan, we stopped working from home in March of 20 on March 1st of 2020, because we felt that, hey, this thing is kind of blowing up. It might be a risk. And even before the lockdown, we said that, hey, offices are optional going forward. And we only opened actually on March 1st of 2021, and then closed again on March 31st of 2021. So the idea was we really figured out that, hey, I mean, I think it's more important that the employees are safe and kind of they are comfortable wherever they are, and providing them with the requisite resources so that they can kind of get their work done. I think I personally think that there is a clear demand for there is a clear need for a hybrid model where people will come, people will have in-person interactions. But I think it is incumbent upon whether it be startups or established companies to figure out the working model. You don't have to have 50% of your workforce or even 100% of your workforce. You can figure out a model that works best for everyone together and for the companies. I think startups have faced challenges. On the flip side, frankly speaking, because of the whole money being pumped, there is actually a lot of opportunities even for startups to raise money. That's actually worked wonders. And the other thing which I'll mention about has really been the fact that at least the financial services sector, it has created a lot of opportunities for startups, and it has accelerated adoption of technology, which would not have happened, frankly speaking, had we not had this pandemic.
Right, right. Absolutely true. You touched upon this briefly, Ankit. So, Sanjeev, I want you to add on this. It's a question on productivity. Uh, Everyone says that, organizations need to be better productive, and while some say work from home has aided, some say it hasn't, but the second pandemic has also impacted a lot of mental health of a lot of people. Families are not well, friends are not well. You're hearing morbid and dark stories every day. How do you balance all of this, the wellness, safety, productivity, all of that? It becomes equally important, because employees who are impacted and whose families are impacted need that time off, and the time off could be anywhere between 15 days to 2 months. So how do you work around that? If both of you can take on a stab at this, it would be great, actually.
So physical health and mental health are closely related to each other, as we know that the psyche impacts your overall functioning of your body, right? So mental health is definitely an area that needs to be addressed. Again, I'm talking about from an employer centric perspective. I think that there is a lot of anxiety in the air in terms of variety of things: my health, my income, my family, the extended community, what's happening to the entire world, when am I going to be able to travel. So there's a lot of anxiety in the air, which I would not qualify them as mental health issues as such. I mean, those are not mental health disorders, but there is the emergence of anxiety that is prevalent in our atmosphere, which has an impact on our immunity. So whenever we do wellness sessions, we remind people that 80 to 85% of the people recover spontaneously without any complications, without any medical intervention. And so it's very important to be able to maintain your overall spirit in a positive fashion. This is another thing that organizations could possibly invest in, is providing mental health counseling as an additional service, at least in the short term, until such time that we get back to stability. Now, whether that's done in a structured fashion through outsourcing mental health counseling, or whether it's done through the HR department, or whether it's done through forming groups like support groups within the organization, is something that can be explored, right? But I think at the end of the day, the employees need to feel a sense of, okay, it's safe for me to get to work, which means my transportation should enable me to not be in a compromised position. I'm safe at home, at my office, in the workplace, where my colleagues are taking the appropriate precautions and are safeguarding themselves, thereby protecting themselves and protecting me as well. And I have a support service. So should in the event that I get sick or somebody else in my family gets sick, I have not just access to medical insurance, but I also have access to counselors who may be able to guide me, or to be able to help me enable myself towards recovery. And I will be welcomed back with open arms once I have recovered from that, right? So I think that this entire time, this pandemic, the one thing I think that the pandemic has taught the entire world is to have what inherently exists within us, to exist in a more empathetic state. And I know that, Ankit, this is very much in contrast to the tone of the conversation, but I think that one must look at, there has to be the duality of the things that are impacting people physically, but also what is happening on the emotional, on the spiritual, and the intellectual aspect of things. I don't think those things can be neglected, because at the end of the day, it's one person that's a whole. An organization is a collective of all the people that are in the organization, right? So I think that providing these additional support services and standing behind, saying, we are with you, because you have given your time to the organization, you have your loyalty towards the organization is also going to be as loyal to you and support you through these difficult times, and we will come out of this together. There's just one other point I'd like to make. While there's a lot of conversation about employers, about the government, about our infrastructure, I think it's at the same time, organizations can also evoke the awakening of citizens, in terms of me being responsible as a citizen in my community, right? So it's not just about me protecting my home and protecting my family and protecting my workplace, but what can I do around my community? There are the people, the watchmen in my community, who's looking after them. There are the people that are marginalized over there. So if all of us citizens start to take a little bit of this responsibility towards ourselves, which again can be something that can be fostered through organizations, because they all have CSR programs. If we foster this in all of the entire workforce, I think the landscape can be very, very different.
Right. Ankit, your take on what can be done to bring in the balance of productivity?
So I agree with Sanjeev on the point of mental health gets kind of neglected a lot of times. I think, but the good thing what we have seen in the pandemic is there have been companies that have been doing some work on that space. So obviously, I mean, we are not the experts, so I won't say at GyanDhan we organize events for mental health. But I think what we benefit from is the fact that the service provider with whom we have our own health insurance, they provide mental health sessions, right? So that is something that the employees can access and can use. So I think that's the best we can do. I don't think you want a mental health session with Ankit on the call, right? But I think we need the right kind of experts for that, and I think that's the good thing, that a few of the startups who are providing these health services or providing these health insurance plans are coming up with, which is really helping the employees. I think from an employer standpoint, the only other thing which we have done in a few cases is we don't have a policy around, frankly speaking, we don't have a policy around taking leaves for mental health reasons or whatsoever. Right. But we made it pretty much, it's a discussion with the reporting manager that, I mean, at the end of the day, mental health is equivalent to someone falling sick due to some physical illness. So I think it will be a discussion with those folks to ensure what is the right frame of mind at which point the employee can contribute actively to the company. And so if they need time off, they should take that time. So I think the overall employers will have to take mental health as another factor going forward.
Yeah.
There's just one thing I'd like to add, Sindhu. So, when you use the term mental health, there is a whole bunch of connotations that kind of go around it. And there is, so you probably know that India in terms of mental health is behind compared to a lot of other countries for a variety of reasons. But one contributing factor to that is the taboo associated with mental health. For me to say that, I'm anxious about what's happening, or I'm sad that somebody in my family has passed away, or I feel guilty that I stepped out of the house and somebody got infected and now has been ill or has passed away, right? So I think there has to be a proactive, there could possibly be a proactive approach by employers to get a pulse in terms of what is the overall emotional well-being of the individual as well, not just the physical health aspect of it, right? So I think this is something that could be fostered, that could result in a happier, more engaged, less stressed out workforce as well.
Yeah.
One thing I'll add here that Sanjeev mentioned earlier on around reducing anxiety, I think, because that's another point which I noticed, frankly speaking, at GyanDhan, and I have seen a lot of startups did a great job at that, was being very clear upfront in terms of who would be impacted and not having this kind of moving goalpost approach, saying, hey, today 3 employees are being fired, then 5 employees are being fired, or 3 employees are now getting a salary cut. I think as an ecosystem, one thing I did notice was most of the startups were very clear in terms of, hey, these are the changes, these will be reverted at a certain point in time, and they have been reverted. I think that is definitely probably takes a lot of anxiety that was mentioned.
Yeah, true, it does. And also, a happier workforce means a more productive workforce, right?
Absolutely.
We're talking about if we're looking at it from a capitalistic lens and economical lens as well. But before I end and let you both go, I want to understand what are your personal learnings from this pandemic. As founders, as doctors, as healthcare professionals, as consultants, what are your learnings, key learnings?
We'll need about 7 hours to discuss those, Sindhu. No, just kidding. So, I think a few things stand out. One is this quotation, very famous quotation, "Jaan hai to jahan hai." That's something that I think that has kind of brought things to in a certain focus. I think that there are many things that we've taken for granted our entire lives, our freedom of being able to do what we wanted when we wanted. That's something that we've realized that, that freedom is something that everybody in the world does not have. And when it's snatched away from you, then you feel that, it's very restrictive. I think the other thing that's been reinforced during this entire time is how our heritage, our Indian heritage, right, which is thousands of years old, which emphasizes things such as a holistic diet, a balanced lifestyle, hygiene. All of these things are intrinsically part of our societies, is the fiber of who India was thousands of years ago, and how this pandemic has kind of brought all of these things to the forefront. Again, realizing that, your hand hygiene, something we've learned since children, washing your hands before you sit down to eat, is such an important aspect that we've perhaps been neglecting. And perhaps we need to go back to our original forefathers in terms of the things that they did to promote their health and to stay safe and to keep the community safe, is something that's important. And of course, one thing I think that's very important is understand that, at the end of the day, we're all human beings. And I keep saying this over and over again. We tend to look at us as human doingers as opposed to beingers. And I think that this pandemic has allowed us to step back and go back into that state of human being as opposed to just human doing. So for me personally, it's been that awakening has been reinforced in this time, and so many other lessons, I mean, that have been learned in this pandemic. So many. I mean, they're countless, really. Off the
Right.
top of my head. Ankit, over to you.
So in addition to what you mentioned, health is wealth. I think for me, again, going back to from a capitalistic standpoint, I'll say there is a lot of opportunities in times of uncertainty. And I think the example I'll give is we figured out that, hey, people need to pay for their education. So rather than giving out longer tenure loans for a large ticket, we started doing small sachet kind of loans for low income households or low to medium income households. And in the last 9 odd months that we have been actively doing that, we have actually not seen even a single customer going delinquent, let alone turning NPA. We have not seen a single customer miss their payments. And that really goes back to, it's not the intent issue. And they have the right intent. So if you design the right product, you will get an uptake and you will get people to buy into your product.
Right.
So I think that for me is the thing, that there is a lot of opportunity.
There's one other thing, Sindhu, which I forgot to mention. At StepOne, one of the things that has happened is that there has been an overpouring of people that have come together. I mean, literally over the course of the past year, past 18 months, we've served millions and millions and millions of patients, and there have been tens of thousands of volunteers that have stepped in to contribute to assisting in any way they can, from doctors to engineers to marketing professionals and stuff. So it's also been visible to me that there is a lot of goodwill that is there to be harnessed in society, which emerges at the time of a crisis. Right now, imagine if we were to harness this goodwill during times of normalcy, how the world could change. We've seen how it's changed in the time of crisis, but the overpowering support that the organization has had from day one has really been a restoration of faith in humanity in terms of people saying we're willing to do whatever is required. For being able to serve millions of people only with volunteers, I think is an incredible achievement. And we're hoping that this is a movement that will persist way beyond the pandemic.
Hope so too. Hope so too. And I hope everyone comes out stronger, safer, and healthier from this. Thank you so much, Ankit. Thank you so much, Sanjeev, for talking to us today. And hope we meet and catch up in person in much, much more better times. Thank you so
Yeah,
much.
Ankit, I think you and I should probably definitely get together, because I think that there are, kind of like it's the yin and the yang, I think, that will come together really nicely.
Perfect. Sure.
Great. Thank you. Thank you so much.